All right, good morning, everybody. I'm going to start today's session. So good morning, my name is James Bradley. I'm the transition navigator, and I work between sick kids and Toronto General Hospital in the sickle cell and thalassemia clinics, supporting patients and their families with their transition from pediatric to adult care. I'll be the moderator for today's session, which is titled Advocating for Financial Supports for Sickle Cell Disease. So as a reminder, today's session will be recorded and posted on the SCAGO website, which is sicklecellanemia.ca, for you and your networks to review as needed after the session. In this session, we are very excited to be hearing from Lembi, Buchanan and Sinthu Srikanthan, who I will be introducing in just a moment. We ask that you save all of your questions and comments until the latter portion of the session, where speakers will be able to answer questions individually. We kindly ask that you respect a few housekeeping rules, which I will go over right now. So first of all, microphones have been muted, disabled for the duration of the webinar. If you'd like to ask a question, please do so by putting your questions in the chat or Q&A function, or there'll be an opportunity, I think, to raise your hand towards the end of the session, though. So we will wait till both speakers have spoken, and then we'll have time for questions at the end. We will do our best to answer all of the questions as well. So there is translation captioning provided, so you can listen in to the session in your preferred language. So you can do this by clicking the show caption at the bottom of the Zoom screen, check the enable translation checkbox, and choose the language that you want the caption to be translated into. We also just ask that you please use respectful language in the chat. Please do not post other material unrelated to today's session. And again, I'd like to thank you for taking the time to join us for today's session. It should be a good one. All right, so having reviewed the housekeeping rules for today, I will introduce our first speaker. So I'd like to introduce Sinthu Srikanthan. So Sinthu is a social worker at the Toronto General Hospital's Red Blood Cell Disorders Clinic. There, Sinthu brings together counseling with advocacy practice to support patients. Sinthu has a strong foundation in community-based social work, including areas such as youth work, gender-based violence, housing and homelessness, and settlement services. She has a background in qualitative research. Please join me in welcoming Sinthu.
Thank you so much, James, for that wonderful introduction. I'm just going to go ahead and share my screen. Give me one moment. All right, can folks see my screen?
Yes.
Okay, awesome. Just give me one. Oh, sorry. Okay. Sorry, I just wanted to minimize my camera view, but I can't do that. Anyways, so thanks again, James, for that introduction, and thanks for SCAGO for inviting me to speak today about sickle cell disease and income support in Ontario. I just wanted to share my disclosures and a disclaimer. I am an employee of the University Health Network, and this presentation is focusing on adults with sickle cell disease in Ontario. And I just wanted to share that this content is for general information purposes only. It's not legal advice, nor is it social work services. And that's important to state because a lot of income support programs are tied up with a lot of laws and legislation. So my hopes for today, so I wanted to set the context. Why are we talking about financial support in sickle cell disease? I'd like to review, how do we optimize financial support through employment, which in our society is one of the main ways that we get income. I'd like to talk about a few key government programs for financial support. And in this discussion, James is going to be linking some resources. And then finally, I want to speak about persisting challenges and resources to learn more. Okay, so let's set some context. So money matters in sickle cell disease. Why do we need to talk about finances? So for most people, sickle cell disease is an episodic disability. So that means that there are times where people have periods of wellness, but they may also have periods where they're unable to work. For people with sickle cell disease, they may have temporary periods of illness. And at the same time, it's also a chronic condition where a lot of work is done to maintain health and wellness. So what that means for people with sickle cell disease, when it comes to finances, To really optimize their well-being, there is a need for both employment accommodations as well as financial support. And both of these are long-term or short-term. In Ontario, I do think it's really important to look at sickle cell disease and poverty as a structural issue. So recent research by Pendergast et al., 2023, found that in Ontario, 40% of all people with sickle cell disease live in neighborhoods with the lowest incomes. And to me, that is like very striking. I think we need to sound the alarms because it's 3 times the rate of the general Canadian population. And the fact that it's 40%, that's almost 1 in 2. It reflects the costs of living with illness and disability. And the fact that it's located in neighborhoods also yields some ideas as to how interlocking systems of oppression, such as neighborhood neglect, racism, because we also know those neighborhoods are home to racialized newcomer communities, are playing a role. Additionally, the fact that it's like located within neighborhoods also kind of directs our attention to community and family contexts of poverty, right? So again, people with sickle cell disease, they're contextualized within families, within communities. There are costs related to caregiving and so forth. So again, this is just to say that poverty is a huge issue. So first I want to talk about employment. Again, as I mentioned, work is the primary means through which we derive our income in society. So one important piece is people with sickle cell disease in the workplace, they really should consider getting employment accommodations. This could maximize your career potential. So when I talk about employment accommodations, last year there was a fabulous presentation by Arch and Ashe, and they really reviewed how sickle cell disease is a disability under the human rights law, and that means that employers have a duty to accommodate. So people with sickle cell disease could take advantage of this so that they are set up for success. So some ideas for accommodation for sickle cell could be flexible work scheduling so that they could attend appointments, time off for unexpected illnesses, so people are not penalized for being sick, and based on the job, opportunity for remote work to reduce fatigue. And I just wanted to mention that accommodations are really, they're person-centered, so it can be helpful, like what works for you, and if it's kind of new to you, you can like sit with a social worker in your clinic to kind of work it out. The second piece of financial support that comes through employment is short-term and long-term disability benefits or employer-sponsored insurance, disability insurance. And these are financial supports through employment if you're too sick to work. Unfortunately, not all jobs have these, but it's good to know if your workplace has it. The rates may vary, so I've seen between 50 to 100% coverage, and the duration also varies as well. They may or may not include benefits such as access to medications, and they do require attending physician statement. And the one for long-term disability is a little bit more comprehensive, and I've also seen that some employers require people to also apply for Canada Pension Plan disability, which I will review later. So I encourage patients with sickle cell disease to learn about what benefits are available through work, if any, and you can contact your employer or your insurance company to learn more. So I'd like to now talk a little bit about government programs, and James is going to be posting some links in the chat. And we also, I forgot to mention this, as a social worker in the RBCD clinic, we do have a blog, and we actually have a blog series. It's in process, but we have a series that describes some of these programs and how it specifically benefits people with sickle cell and other red blood cell disorders. So the first benefit I'd like to mention is unemployment insurance, and specifically EI sickness benefits. A lot of people don't know that, people know about EI regular, but there's actually a sickness benefit, and it provides financial support if you can't work due to sickness and you have no workplace benefits or you've exhausted it. So it provides 55% of your income for 26 weeks, and it's up to a maximum of $650 per week. And it's, it's basically, money that you've paid into. So it's if you've made EI contributions, you qualify, and there's no health benefits or drug coverage, so that's important to be aware of. And as I mentioned, the requirements is that you've worked the number of insurable hours, so it ranges between 420 and 720, I believe. It's based on unemployment rates that are set by Service Canada. And you also need a medical certificate. The medical certificate is not really that comprehensive, and there's no medical adjudication. So it may be a conversation with your healthcare provider. So I've linked the QR code. We do have a blog post that speaks to the EI sickness benefits and how it can help people with sickle cell disease. So in Ontario, so if you've exhausted EI sickness, or you don't have any financial support, there is Ontario Works, which is a form of social assistance. So it provides immediate financial support for folks in need. There is a requirement that you are participating in employment search activities, and these rates are set by the provincial government. They are inadequate, and there needs to be more work on improving social assistance rates. But they do include health benefits, so drug coverage, as well as medical transportation. And the requirements is that you have little or no income and assets that are less than the value of of those set by the program. And James will be linking that in the chat. The calculation is based on your household size as well as your expenses. So I've kept it general, but I really encourage people, if you feel that you qualify, apply and let them make the decision. The next program I'd like to talk about is the Ontario Disability Support Program. So this is also a form of social assistance in Ontario. James will be linking in the chat, and we have an article on the ODSP program that again links it to sickle cell. So ODSP provides long-term financial assistance for folks who cannot work to disability. Again, the rates are set by the provincial government, and again, the rates are inadequate. The health benefits from ODSP include drug coverage as well as medical transportation. And the requirements, you have little or no income / assets that are less than the value set by ODSP. And then there's a second requirement, which is that you meet the program's definition of disability. So that's linked in the link that James has provided. And I should note that different programs will have different definitions of disability. So the next program I'd like to discuss is the Canada Pension Plan Disability. Again, this is also another form of long-term financial assistance for people who cannot work due to disability. And this definition of disability, it's based on the federal government. It's a bit more stringent. So folks who qualify for ODSP may not qualify for CPP disability. The rates are based on your contributions. So it's a maximum of $1,538 per month. There are no health benefits or drug coverage with CPP disability, and the requirements is that you meet the program's definition of disability and you've made sufficient contributions. Finally, I wanted to mention that in Ontario, we do have the Trillium Drug Program. So some of the benefits I mentioned don't have health benefits. And additionally, some jobs don't have medication coverage. So the Trillium Drug Program is the province's pharmacare program. It's not like full coverage, but it is a little bit of financial support. So it's for people who have no or insufficient drug coverage. And how it works is that you pay a deductible of basically 4% of your income on medications, and then the Trillium Drug Program covers the rest. And you have to apply for the program. So you're not automatically signed up. You have to have an OHIP card, and it's for folks between ages 25 to 64. So I just wanted to wrap up with some concluding thoughts. So those are the main programs. There's some additional programs based on different circumstances, but those are the main ones. So there are a lot of challenges with the government programs. A lot of the income support does not reflect the cost of living in Ontario. There are gaps in support. So, you might be without income for certain period of weeks, as well as in health coverage, right? So we saw with EI, CPP disability, there's no really drug coverage in those programs. It can be really confusing to navigate these social welfare programs, and a lot of the questions are very intrusive. And they ask a lot of personal information about your family. So these are like barriers to accessing benefits. Finally, and this is going to be touched upon, I believe, in the next presentation, a lot of the benefits appropriate for sickle cell disease, so ODSP, for example, as well as CPP disability, they work from a medical model of disability. And that means that they're looking at disability, not from a social perspective. They're looking at really stringent criteria that's just not, reasonable and capture people's experiences. And, it's based on the idea that only, certain people in our society deserve government assistance, right? And, my experience is that a lot of times folks with sickle cell disease, they're often found as ineligible for disability benefits. And it's linked to this idea that, again, certain people are deserving. And this is very much racialized. It is quite interesting why sickle cell disease, which, predominantly affects Black folks in Ontario, is not recognized as a disability, therefore not recognized as deserving of, benefits and accommodations that would really support people's lives. So I wanted to link resources to learn more. So this is our blog. We have a resource page, which has links to all the resources. And then we're also having a blog series. It's still being written up, but we have articles on ODSP as well as EI sickness that really explains the benefits and how specifically it's beneficial for folks with sickle cell disease. These are my references, and thank you.
All right, thank you so much, Sinthu, for an excellent presentation on some of the financial supports available to people living with sickle cell and other red blood cell conditions. It was an excellent presentation. There's so much information in there, and I'm really thankful that we have the resource links that you provided, because they can be good to review in more detail if you're interested to learn more. So we will have more time to chat about Sinthu's presentation at the end. So without further hesitation, I will move on to our next speaker for today. So next, I'd like to welcome our second speaker for today's session, Lembi Buchanan. So Lembi is a leading advocate for Canadians living with mental illness, taking on the Canada Revenue Agency single-handedly and winning. Her dedication and perseverance lobbying the federal government for more than 20 years has helped to ensure fair tax treatment for her husband, Jim, and others living with disabling conditions that prevent them from fully participating in activities of daily living. In 2001, Lembi established her Fighting for Fairness campaign and spearheaded the Coalition for Disability Tax Credit Reform that led to important amendments in the Income Tax Act. As co-chair of the Disability Tax Fairness Alliance, Lembi continues her advocacy work to ensure that government policies do not discriminate against some of the most vulnerable members of our society. Her memoir, An Accidental Advocate, illustrates why every person facing any kind of illness needs an advocate. So please welcome Lembi.
Thank you very much for that introduction. I'm really pleased to be able to join you, and I will also be talking about some of those very stringent restrictions when applying for income supports. So first of all, a disclaimer that I am not a lawyer and I won't be providing any legal advice. I'll just be talking about my own personal experiences and my advocacy work for the DTC. So there have been considerable changes to the disability tax credit in changes administratively and legal changes to the criteria. And now we have an electronic form that is available. So we have now an online application form. You can still download the PDF file, print it, and take it to your doctor. But there's an online form where you can go online complete Part A, you will be given a reference number, and then you'll go to your doctor, provide the reference number, and he can complete the form electronically for you. And a little bit later, we'll have a couple of pages of the form that we'll be able to share with you. So the history of the DTC was originally for people who were blind or in wheelchairs or confined to bed. In 1986, it was opened up to people with physical and mental impairments. The disability tax credit reduces tax liability for an individual. That's how it was set up initially, to cover some of those unexpected costs that aren't covered by the medical expense tax credit. And also, it's now the gateway to so many other programs that I'll discuss later. So could I have the PowerPoint slide for the first item? I don't have a I'm sorry, I've
The
lost.
slide with the DTC?
Yeah, the first one. A person may be eligible.
Yep.
Okay, is it showing?
Yes.
Because I don't see anything. So eligibility for the DTC is dependent not on the medical conditions such as sickle cell disease, but on its disabling effects on activities of daily living, all or substantially all of the time. So a person may be eligible if they with various mental or physical conditions, whether it takes whether they're unable to do the task or it takes them an inordinate amount of time. And an inordinate is being slated as at least 3 times as long. So that means if it takes you 3 times as long to dress yourself or walk, or because of pain or swelling in the joints, you may also qualify. So could you put the the categories, the next slide?
Yes.
Okay, so the activities of daily living that qualify for the DTC are vision, speaking, hearing, walking, eliminating, that's bowel and bladder functions, feeding, including food preparation, dressing, and mental functions. So and cumulative effects. So the most important, those are the activities of daily living, but the category of cumulative effects is certainly the most interesting one, and I'll talk about that a little bit later also. So the health practitioners that are able to complete the form for you, only doctors and nurse practitioners are able to complete all sections. So the other practitioners may authorize to provide the information required for each impairment, may be an optometrist for vision, an audiologist for hearing, an occupational therapist for walking, feeding, dressing, a physiotherapist for walking, a psychologist for mental functions, a speech language pathologist for speaking. And once again, only a medical doctor or a nurse practitioner can complete the form for all patients. So the cumulative effects category was created in 2005, and it recognizes that an individual may not meet the strict eligibility criteria for being markedly restricted in a single activity of daily living, but is significantly disabled in 2 or more activities of daily living and therefore may qualify. So there's a kind of difficult to understand the difference between markedly restricted and significantly restricted, but I'm sure the medical practitioners have had a great deal of experience dealing with these very obtuse forms. So first of all, I want to talk about physical impairments. So if you could put up the page, the walking page on the screen. Do you have that?
Yes.
Okay. So health practitioners are provided with a Likert scale for both severity and frequency of disabling effects. So as you can see, the severity goes from mild, mild to moderate, moderate, moderate to severe and severe. And also there's a frequency scale.
Hi,
Rarely.
Lembi. Lembi,
Yes.
sorry, I'm just going to interrupt you for 1 sec. On my end, I don't see your slides. I just want to flag that for Sam before you move forward. Yeah, so just want Sam to know, but sorry to interrupt. Back to you.
So
One moment. Sorry about that. Let me try something.
I'm having okay. So do you have the slide now?
All right.
Okay.
Can you view them now?
Yep.
Okay,
So the Likert scale is a terrific improvement in the forms because it really enables a physician to a health practitioner to have a range, and we're all familiar with Likert scales. So we're very pleased to have this introduced in the new electronic application form. So going back to cumulative effects is my understanding of sickle cell disease is people may have various impairments because of their pain and swelling in their joints. So they may have issues with walking or dressing themselves, feeding themselves, and feeding includes meal preparation. It does not include purchase of food, but meal preparation. So it's really important for you to review this form very carefully before you go to see your doctor, and even fill in the areas of questions where you might think that, where you believe that you are impaired. The doctor cannot send your form in, but at least he'll have some guideposts, because obviously he's not with you 24 hours a day or with your child 24 hours a day. So this cumulative effects is a really, really important initiative for our tax, for understanding the severity of the impairment. Vision's a little bit different. Vision, I don't have a slide for vision, but although individuals diagnosed with sickle cell retinopathy may not qualify under the very strict guidelines for vision, by including other areas of impairment, let's say walking, feeding, dressing, etc., they may qualify. So it's important, if there are any vision issues, that section is completed as well. Now we're going to move on to mental functions. And could you please put up the page for mental functions? No, that's all. Oh, I'm sorry. I don't, it's the page. It's page 12 of the form.
Perfect.
Okay. This is the most complex and controversial section of all the areas of determination of eligibility. And this is the area that I've been fighting for more than 20 years. They continue to make it changes to the form, and it becomes more and more restrictive for people with mental functions, and I'm not sure why. So in 2021, when the electronic form was first introduced, we had the same Likert scale as we have for physical impairments, like the page that you just saw for walking. We had the moderate to severe category, and we had the frequency category. Now we have something entirely different. And at the present time, I'm very involved with trying to get the form reverted back to the same Likert scale for mental functions as for physical functions. So we have no limitations, some limitations, and very limited capacity. And very limited capacity is certainly an extreme. So there are certainly many areas where you might be discussing with your doctor about issues that you might have. You might have issues with concentration or anxiety or the inability to cope with stressful issues. So this is only one of 2 pages of various examples for the doctor to complete. So it's really important, once again, that you review all these issues. And this list is not exhaustive, it's illustrative. So your doctor can add in other issues too that might be pertinent to you or your child. So if CRA is not satisfied with all of the information that they've received with the form, then they may send the doctor what is called a clarification letter. And this is just a questionnaire with some additional questions. So that your doctor may call you in again and go over those questions. So I wanted to mention the gateway. If we could put on the other slide that we have. So since 2008, when the federal government introduced the Registered Disability Savings Plan, the DTC eligibility became the gateway for that plan. And it's a gateway for the child disability benefit, which is a really important benefit for many families. Also, the qualified disability trust, the home accessibility credit, as you can see, home buyers plan, disability employment benefits, Canada workers benefit. You've already heard about the Ontario workers benefit. And now the Parliament passed in June last year or this year, the Canada disability benefit. So we believe that the DTC may also be one of the gateways for the new Canada disability benefit. We're involved with the discussions with the federal government regarding that. We're not sure. They'll be creating some regulations, and those should be coming out next year. So don't hold your breath. It's not there on the horizon yet. But for individuals who may not have, I wanted to mention also that the DTC reduces tax liability. And if an individual doesn't have a taxable income, a family member can also participate in the DTC. So if I'm open to any questions that you might have. Thank you very much for enabling me to provide this presentation for you. Thankfully, technology works very well so that I can talk to you here from Victoria and join your group. Thank you again.
All right, thank you so much, Lembi, for your presentation today. So now we've reached sort of the end of the presentation, the 2 presentations, I should say. So Sinthu and Lembi, I just wanted to give a couple of thoughts. Lembi, it's so useful to have your advocacy work and your experience with these forms and sharing that with us today. So thank you so much for that. I do have some questions in the chat. So maybe I'll move towards asking some of those. So if anybody that is here with us today would like to ask any questions, please put them in the chat or the Q&A box. My first question for today is going to be, actually, this one here. Sorry, just moving a few things around. So we have one in the chat for Lembi. So Lembi, what are your thoughts about the CRA, including other professionals such as social work or case managers, in completing the DTC forms? Many of the items addressed in the DTC forms look at the person in their environment, which doctors from that medical view maybe don't have the full perspective on. Do you have any thoughts on that?
So we've had umpteenth discussions. I've been involved with many committees precisely about these issues. CRA isn't interested, quite frankly, about social issues. And also, there's an issue of licensing that so physiotherapists can deal with walking because CRA is satisfied that it's a licensed occupation. So that's the area. I mean, we've had a lot of, many organizations have made presentations, and there's no reason why an organization cannot make a presentation to CRA and asked to have a certain group of individuals licensed and authorized to complete the form. But they're basically looking at medical information. It's just the same as with the other issues that we were dealing with earlier.
Great, thank you. That's a helpful response for us to think about a little bit. I have a question here for Sinthu, and this previous question actually ties into the next question. So Sinthu, when you were talking about some of the disability requirements on the forms that patients might be bringing to their care team, you mentioned that, again, that takes a very medical approach, which can be frustrating for many people for many reasons. Do you have any ideas as to how these forms could include other criteria, or how could we advocate for those changes on sort of the end of the forms on the government level?
Yeah, so I think so. For example, ODSP it is medical model, but there is they do have a self-report where you can write about your experience of disability as well as other forms of discrimination in your life, because we can't be separated into distinct parts, right? So I encourage people who are applying for ODSP to take advantage of that, and I believe the CPP disability also has a self-report, so that's an area where you can kind of bring in the social perspective as well. I'm not sure how heavily it's weighted in adjudication, but I always encourage folks. I think, the medical model, it's really designed to exclude people, right? And, a lot of people who could benefit from disability benefits, right? They are just, it's used to like just screen people out. So I really do think, social movement, joining the campaigns like Lembi's campaign for the DTC, it's really about making sure that folks who need the support qualify, right? And that form that Lembi had shared, it's really about like keeping people out of like barring people from service, right? So I think like joining like social campaigns and really looking at the social model of disability, right? There's also disability justice movements as well, and I really think our governments really need to be receptive. So yeah, I hope that answers the question, James.
Great. Yeah, that's a really useful way for us to think about it as well, especially with pieces like that self-report. So kind of knowing where you can include, a different perspective in the application as well. So I did get a question in the Q&A here. So it says, is sickle cell, sort of as that diagnosis of sickle cell, recognized under the disability tax credit as of yet? So maybe Lembi, I don't know if you have any thoughts on this one, any knowledge?
So it's not the medical condition, it's the disabling effects of the medical condition that are the key. So the only, certainly if you're paraplegic, that's the non-starter, that's easy. Or if you have dementia, and dementia is the only mental impairment that's really looked at as being permanent, not temporary. And this is a real frustration for people with mental functions because they have to reapply it every 5 years. So once again, it's important that whoever is looking and reviewing the form understands the disease component, but by itself, it's not enough.
Okay, thank you.
I should mention, I do have a website, fightingforfairness.ca. And I do have a lot of pages in there that certainly provide some input in terms of what you might be looking at, particularly in the mental functions area when you're completing the form.
Great, thank you so much for that answer. So I've got a couple more questions here. So this one, I believe, would be for Sinthu. So it says, my doctor doesn't think that I should be eligible for the ODSP form when I bring it to them. Do you have any idea of what I can do next?
Thanks, James. That's a question I get a lot. And I guess this is a message to doctors. Doctors document, adjudicators judge, right? So I think there's a misconception amongst the medical community that the disability is determined by them. but actually their role is to, record their clinical assessment. And, it's a conversation with the patient as well, because the functional like implications of their diagnoses, that's going to come from the patient, right? So I think, there needs to be some, education within the medical community about their role, because, that kind of becomes kind of a gatekeeping role. So, I would recommend, it's hard to put this on the patient. I do recognize there is a power imbalance, but really, having a conversation with the physician, right, about, like just clarifying, like, I'm asking you to like document. I do recommend patients, when it comes to the disability forms, like really make that a medical appointment, right? So like it's not dropping off the forms, but like having an appointment with your physician or nurse practitioner. It's also now, I think, a nurse RN can complete it. And you can review the application with them as they complete it, right? So it's not just kind of like dropping the form up and picking it up, but like reviewing it and talking about how it impacts, how your diagnoses impacts your day-to-day life, right? And yeah, I think that would be my suggestion.
Great, thank you for that, Sindhu. That's useful. Okay, so I've got a question here along similar lines. This one's for Lembi. So Lembi, what if you were denied your application for the disability tax credit? Can you outline if there's a process to appeal or apply again, or what you might do in that situation?
So if you're denied, you'll receive what is called a notice of determination denying the DTC. So you can request a second review, and it would be helpful to have something from the doctor as far as this is concerned. And just what we heard before about doctors not wanting to complete the form, this is another huge issue with people with applying for the DTC. And that's why the Likert scale, why I like the Likert scale so much, because the doctor doesn't have to say severe, but moderate to severe. If you're moderate to severe in a number of categories, you may qualify for the DTC. And we didn't really have that option before. We just have to fix the area for the mental functions. If you're rejected a second time, then you can file an objection, what is called an objection. And it's just writing a letter. There's information on my website, again, fightingforfairness.ca. And if that doesn't come through, then your next method is filing a notice of appeal with the Tax Court of Canada. And I take you through the steps also on my website. Going to tax court may seem very intimidating, but the judges are always very compassionate and they want to listen to the whole story. They're interested in the social issues. Believe me, they understand how the social issues implicate with the medical issues. And if you're under a lot of stress and can't manage the stress and anxiety. So, and quite often these cases get settled out of court. You never even step inside the court. Doesn't cost any money to do that. And again, I take you through the process on my website.
Great. Thank you so much for that answer. Another one here for you, Lembi. Can you apply for the disability tax credit for previous years?
Yes, this is one of the beauties of the DTC, and particularly for children. Let's say you just found out today about the DTC and you feel that your child may qualify because the child is having a lot of issues. Then obviously the child is not, we're not dealing with food prep or whatever, but even as an adult. So you can go back for 10 previous years if you have the medical documentation. Obviously, if you have the same doctor, it makes life much easier in that sense. But this is huge because if you can go back 10 years, then if it's a child, you get the child disability benefit also. And the other thing to remember is this registered disability savings plan. You don't even have to have an income or pay taxes, but you can still, if you qualify for the DTC, you can set up a RDSP for your child and take advantage of various bonds and grants from the government.
Great. Thank you for answering that one. I do have another one for Sindhu. You may have answered it partially when referring to the ODSP question, but what are some ideas to improve income supports for income support programs for people with sickle cell disease? Do you have any ideas?
Yeah, I think like we need to have like a universal basic income. I think our social welfare programs in Canada, like it's based on it's based on like the Elizabethan poor laws, so that, like the only people who deserve benefits are those who are, the deserving poor, aka disability. But these categories start, it starts excluding people, and in our like people with sickle cell disease do get denied a lot, and so again, it has a racist meaning. So I think we do need to advocate for like change, like so that everyone gets a decent standard of living, right? And so you take the doctors out of it, you take that judgment out of it, right? And so we as a society, we as a society, like, and everyone, because they are a person in our society, will have a basic standard of living, right? So I do think we need to work towards that. And I wanted to share an example. The Trillium drug program, we only have it because the HIV/AIDS activists in the 1990s, they had no access to medications and were dying. And what happened was they actually threatened to burn the premier at the time in effigy on World AIDS Day. And so a week later, he came up with the catastrophic drug coverage program, which, was the Trillium drug program. So social activism. So I'm not saying that, I'm not saying, to go out and burn Doug Ford in effigy, but I'm just sharing that to say that we do have programs, the programs that we exist, people fought for them, right? So I do really think for sickle cell disease, I do think we need to connect these struggles to like broader issues, right? Of, basic income, national pharmacare program, and so forth. Is that helpful, James?
Yeah, that's a really kind of eye-opening example, especially that you shared there. So it kind of highlights some of the advocacy work that has been done in other programs, and maybe some ideas as to where we could focus efforts in sickle cell care. Great. Okay. So I think I've gone through all the questions that have come through the chat here. Are there any final thoughts or questions for today's speakers? I'll give it just a moment for any last minute ones to come in. Lembi, were you going to share something there?
Sure. Advocacy is really important, and it's really important to get to get others on board. The most of all the advocacy tips that I've ever tried or promoted, the most important one is if you're having issues, particularly with a child, and you feel that you should be eligible for the DTC, the child should be, but somehow you're not getting through, you can always send a letter to your member of parliament. There's no charge for sending a letter to the House of Commons. And I would put a photo of the child in with the letter so that they can hold that child in their hands, so that they can see who that child is. Because your own MPs are really incredible advocates. So get to know them and send them a letter.
Yeah, that's a great final thought. Thank you for sharing that one. I mean, I think as we've discussed today, there's so many different levels where advocacy can take place. So I think the speakers have done a great job of highlighting some of those different areas. Okay. So the participants here will likely see the poll that has come up. So please, if you see that one there, please answer the questions in front of you there. Thank you so much for joining today. Let me just go back to my list here. So we are wrapping up now with the poll. Thank you so much for joining us today. We had two excellent speakers, definitely learned a lot about the different resources that exist. I believe next is lunch, and then we will be doing the next sessions that will resume at 1:20. So please check the schedules and join the tracks that interest you. Thank you so much for joining today.
Thank you again.
Thanks, everyone. Bye.
All right, thanks, Lembi.
Okay, thank you.